Welcome to the board summary of the latest board, which took place on the 30th of January. We didn't have a patient story this month, so our meeting was operationally focused and around a number of areas. We started the meeting reflecting on the CQC inspection, which is now complete. All the key services reviews took place before Christmas, and then we had the well-led and use of resources review in the second week of January, which also coincided with the review of the maternity service. We're awaiting formal feedback, get a draft response and a draft report, including our rating in early March. But the verbal feedback that we've had has been really positive, and particularly highlighting the strength of the culture here at YDH, which was really pleasing. We moved on to an operational update. It's clear that since the New Year period, the organisation has been in a period of heightened escalation with norovirus and high levels of demand following the Christmas period. This was planned for. Our winter plan has worked really well up to now, despite the increase in activity. Opening of Jasmine and the use of the Kingston wing, particularly to support elective operating, has meant that we've had a much lower level of cancellations of elective operating this year than last year. We took some time to consider the impact of the NHS long-term plan, which was published on the 7th of January. And this set out a whole heap of expectations and ambitions for the NHS over the next 10 years, and also how the £20 billion worth of funding that's been allocated to the NHS will be prioritised. I've got there's a one-page summary of the plan here, and just to give you an idea of some of the areas of focus. Boosting out of hospital care is an area of priority, and particularly the integration between primary care and community services. And this is very much being driven through the establishment of primary care networks of GPs focusing on populations of between 30 and 50,000 people, very much in line with the work that we've been doing around Symphony, and which is now being rolled out across Somerset. An ambition to reduce the pressure on emergency hospitals services, which I think we would all welcome, and that's really through investment and development in pre-hospital urgent care, same-day emergency care, so things like ambulatory emergency care and our frailty assessment service, and also by cutting delays in patients being able to return home. So again, all the good work that we've been doing around Home First over the last year. A really big focus on personalised healthcare and tailoring healthcare to individual needs, as well as therefore tackling inequality and illness through a greater focus on prevention. A real big focus on digital technology and using technology to deliver care in really different ways. And finally, a theme around moving to what's being called integrated care systems across the NHS. So this is where individual providers and commissioners like the CCG come together in much more of a partnership way to manage care through one set of and one use of resources, rather than the traditional way that has emerged through the reforms in 2012, with a real split between providers and commissioners. So again, we're thinking very much around how that impacts on the way that we organise care here in Somerset. We received an assurance assessment from Angela Turner and Yvonne Thorne around our emergency preparedness, which in summary shows a good assessment of emergency planning. The assurance also took into account business continuity, and it's clear that there's some work to do on that front, particularly in four particular areas. So Yvonne and Angela will be working with business managers in those areas to strengthen our business continuity plans, which I'm sitting here today on a day where we're thinking about snow and ice, so really important that we have strong business continuity plans in place. And we also heard from Yvonne about some of the challenges at the moment and the planning that's going along for a no-deal Brexit, which again, business continuity, things like us being able to source our supplies of medicines and consumables and food is really, really important. This is being coordinated nationally, and there's also a clear mandate to individual organisations that we shouldn't be stockpiling, but further work over the coming weeks, depending on all of the very live conversations that are going on nationally at the moment. We received an update from Kathleen Fernando following our recent trauma peer review. We're part of the Bristol Trauma Network, and the peer review really highlighted the strength of the service and the quality of the outcomes delivered here at Yeovil Hospital. And this is really important given our geography. Trauma units have to be within 45 minutes of the trauma centre, so clearly the geography of YDH dictates that there needs to be a trauma unit here, and so it was great to hear the quality of the service that we're currently providing. We had a deep dive into our performance. I think that the headlines really are we're, from a financial perspective, on track to deliver. We delivered our financial control total in Q3, but Q4 is going to be a real challenge for us. We are delivering strong performance against all of the clinical quality and operational metrics, and there's been some really positive news, particularly around appraisal. The appraisal rate and also staff turnover. Appraisal rate is now almost at the 90% target, and the turnover rate has reduced over the last couple of months. We had the board approved yesterday a business case for the replacement of the lifts in the women's hospital, which is an area of risk for us at the moment. So we should see going into the new year works now commencing on the lift replacement programme. And finally, we considered a whole number of standard reports. Highlights from those being the Safer Staffing report, where we review our nurse staffing levels across the hospital. A report from the Freedom to Speak Up Guardians summarising their activity. Our Learning from Deaths report, and a report from our Guardian of Safe Working, looking at junior doctor hours. So those were the main points from the January board meeting.